give the law enforcement, the prosecutors, the tools they need to fight this, the quicker we address the issue. But there should be no more delays, no more arguments, no more politics. We have an issue in the state of Missouri with homicides, especially in the St. Louis region and the Kansas City region, and we have to address those issues. Today marks the 72nd press conference laying out our administration's wide effort to respond to COVID-19. We continue to monitor COVID very closely and accelerate testing across the state. 91,000 tests were performed in the state just 2 weeks ago in a week's time. A far cry from when we were trying to do 3,000 and 4,000 when we all started with COVID-19. This is a huge increase from where we were and when we first started testing. We have come a long way on the ability to fight and respond to COVID-19 since March. We also want to stress the importance of counties utilizing their funding they have been given. I will stress to the counties on the local levels again. You received CARES Act funding very early on. You need to utilize that funding when it comes to testing and contact tracing. You need to use that funding to help to make the kids in your community and your school systems safer also. And it needs to be done now to help fight COVID-19. Delaying these funds, delaying them getting out there and to be utilizing them for what they need to be utilized for needs to happen. This virus is still here, and we must continue to be proactive. But overall, our hospital system still has the capacity and is stable. On the economy front, the recovery continues to receive good news. Last night, Chewy Incorporated announced plans to open a new 800,000 square foot e-commerce fulfillment center in Belton, Missouri, which will bring over 1,200 new jobs to our state. That is 1,200 new opportunities for Missourians during a critical time in our state. Chewy's decision to expand in Missouri says a lot about our strength in businesses and infrastructure, even as we recover from COVID-19. This is a huge win for our economy, the Belton community, and the entire state of Missouri, and we are excited to welcome Chewy to our state, along with Accenture just a few weeks ago, adding 1,400 new jobs. We are on the right track and need to continue to expand our businesses in our state. This announcement is just another sign that our economy is bouncing back, and we continue to be optimistic for the future. This week, the Department of Economic Development is also rolling out 3 additional programs as part of our Show Me Strong Recovery Plan. One of these is the Small Communities Operational Capital Loan Relief Program for Missouri's incorporated municipalities under 25,000 in population. This program is designed to give Missouri communities access to an interim working capital loan to address projected shortfalls due to COVID-19. A total of $5 million is available under this program, which will be administered by the Missouri Development Finance Board. Again, this program is really designed for some of our smaller communities that was hit the hardest. These are mom and pop businesses out there that we're trying to do everything we can to help them. DED will also be announcing opportunities for Missouri nonprofit organizations. Nonprofit organizations have been a lifeline for many Missourians during this crisis. This new program could provide up to $22 million in grant funding to support nonprofits in meeting critical needs in their communities due to COVID-19. These grants will ensure that they are able to continue assisting those who need it the most throughout the recovery process. And finally, DED will be announcing a grant for co-working and incubator spaces in Missouri. This $1 million grant program will help the organizations with expenses related to updating their facilities to encourage social distancing, enhance sanitation protocols, and acquiring PPE. In addition to these programs, we also have good news from the agriculture industry. Today, Director Chin is here to share details about our opportunity for meat and poultry processing in Missouri. Director?
Good afternoon, and thank you, Governor Parson. Today, I'm here to announce the creation of the Missouri Meat and Poultry Processing Grant, which is part of the state's CARES Act allocation from the federal government. During COVID-19, our food supply was tested from farm to fork. Farmers and ranchers saw tight livestock supplies on their farms, while consumers saw their choices of certain cuts of meat shrink or go away. In some cases, the cost of meat went up. We're fortunate in America that we spend less of our disposable incomes on food when we eat at home than any other country in the world. Even with short-term price increases in the last few months, we're proud of the resiliency that our food supply has shown, and we're pleased to see prices and meat supplies start to return to normal. As farmers ourselves, Governor Parson and I have worked hard to campaign and champion the resiliency within our food supply during COVID-19. Unlike other aspects of our economy, our food supply depends on local farmers, ranchers, and food processors. Within the department, our meat and poultry inspection team has offered flexible time schedules for our meat processors. As a result of this, we've doubled the amount of red meat under state inspection. These are typically your smaller processors. These small processors are necessary for local food systems, and they serve a critical role in our rural community economies. That's why I'm proud to announce that the Missouri Department of Agriculture will be making $20 million available for small meat and poultry processors that employ less than 200 employees. This money is a part of the CARES Act appropriation. The grant will be tiered to promote livestock and poultry processing. Facilities can receive up to $20,000 maximum. State or federal inspected facilities can receive up to $100,000 maximum. And state or federal inspected facilities that also harvest livestock can receive up to $200,000 maximum. The application deadline will be August 31st of 2020. Examples of eligible expenses include, but are not limited to, capital improvements that expand capacity, utility upgrades like cold storage, processing equipment, packaging equipment, and more. To see the full list of eligible expenses and download an application, please visit agriculture.mo.gov. During COVID-19, livestock producers and consumers were able to connect and establish new, long-lasting relationships. I want to thank all of our meat and poultry processors for their hard work through this pandemic. This summer, we saw processors of all sizes working longer hours and extra days to help keep up and make sure our families were fed. You are the perfect example of what drives Missourians to care for each other in the midst of challenging times. I'd also like to thank Senator Justin Brown for his leadership and the state legislature in securing this appropriation to help support the future of our food supply resilience. We believe this grant program will be a win-win for both our farmers and our consumers. Thank you.
Thank you, Chris. As we move forward, mental health continues to be a priority. This is just as important as physical health to our recovery efforts, and we are doing everything we can to provide Missourians with the resources they need to stay healthy, both physically and mentally. Today, Director Stringer is also here to talk about several funding opportunities for mental health. Director?
Thank you, Governor. First and foremost, on behalf of the Governor, his staff, and my colleagues on the Cabinet, I want to again offer our sincere condolences to the families that have lost loved ones to the virus. We will never lose sight of the pain and suffering that you have endured. I'm here today to announce that Governor Parson has authorized a significant investment in Missouri's behavioral health and developmental disability services, and in 5 specific areas. First is relief for our contracted community providers who, as a result of the pandemic, have lost revenue due to disruptions in service while incurring additional costs for things like testing, PPE, and overtime. So the governor is making $20 million in CARES Act funding available to about 350 Medicaid providers for the Division of Developmental Disabilities. $17.6 million is allocated for providers of group homes and supported living services, and $2.4 million is allocated for dayhab and employment providers who lost revenue also. These funds will help cover losses for the period from March 1st through December 30th. Providers will need to apply for the funds, and they will have until December 30th to do so. Instructions on how to apply will be posted on the DMH website. Likewise, $10 million from the CARES Act will be available for community behavioral health care providers, which includes providers of mental health and substance use services. Many of those providers have also seen significant losses along with increased costs. These funds will be essential to preserving access to care during a time when the need has never been greater. In both urban and rural Missouri, our contracted providers are seeing significant increases in crisis calls and requests for services. The funds will allow providers to support needed staffing levels and continue to improve technologies as well as increase their ability to reach and serve people through means other than traditional in-person care. The third investment, and related, is $3.5 million for an integrated care telehealth training center that will be available for both behavioral health services offered by DMH providers and primary care services offered by federally qualified health centers, or FQHCs. Both systems have had to change dramatically to become more focused on telehealth. In-person training and education have stopped, and they're being replaced with distance learning and audio-visual technologies that need to be learned. It's critical that the state's safety net services for people with disabilities and for low-income families served by FQHCs, community mental health centers, and substance use treatment providers, that they be equipped with for this new environment in order to continue with professional development and quality improvement. The training center will allow both the Missouri Primary Care Association and the Missouri Coalition for Community Behavioral Health Care to leverage common data and their jointly operated healthcare home programs to improve care for the nearly 500,000 patients that both systems serve. These funds will be supplemented, by the way, with funding from the two associations. The fourth investment is $3.2 million for telemedicine for people with intellectual and developmental disabilities. The department has partnered with an organization called Station MD through a contract for telemedicine services to be offered at no cost to all Medicaid waiver participants through December 31st. So about 15,000 individuals in DMH waiver programs, these are people with developmental or intellectual disabilities, 15,000 will be eligible for this service. The service will allow individuals to receive medical care in their homes and avoid exposure in physicians' offices and emergency rooms. Station MD offers immediate virtual access to emergency medicine physicians specifically trained to take care of people with intellectual and developmental disabilities. Finally, we recognize that the current COVID-19 crisis will contribute to increases in depression, anxiety, trauma, grief, and other challenges. Those challenges may lead to suicide and suicide attempts. Therefore, I'm pleased to announce that the governor is investing $620,000 of CARES Act funding so that we can continue our current public education effort around suicide prevention, and we can continue it for several more months. We hope to reach all Missourians who are in suicidal crisis, as well as their friends and loved ones who can help intervene. And we will have a special focus on middle-aged men in rural areas, and that group has the highest suicide rate of all. In addition, we are again partnering with the National Crisis Text Line to provide the crisis text number. Messages are targeted to youth and young adults, mostly through social media, encouraging them to text if experiencing a crisis. For example, one public service message will be, quote, "Even in isolation, we're still connected. Talk to a crisis counselor anytime you need. Text MoSafe to 741-741, end quote. The campaigns will include billboards, radio ads, and social media posts that educate on the warning signs of suicide and how to get help. So, Governor Parson, I can speak for the Missouri mental health community and the people we serve in saying that we are truly grateful for your ongoing support and this sorely needed additional funding. Thank you.
Mark, thank you very much. Let me just say this about Director Stringer and his department over the last 4 or 5 months. One of the agencies that have definitely been stressed to the max over that time period, with a lot of them still to be able to provide the services to people out there. My hat goes off to a lot of those people, and he's up there speaking reminds me of the losses we've had due to COVID-19 over this time period. As we look at numbers sometimes, we need to also remember the people business owners that lost an employee, family members that lost a loved one. Somebody's been affected by this COVID-19 that it's been pretty close to us, even state employees. I know Mark dealt with that, and his administration did, on the loss of a state employee. We've had spouses that are state employees lose their husbands. So I just want to say our thoughts and prayers are with everyone that are still dealing with this. Sometimes in the media hype, we don't take enough time to recognize the people that's really going through this when it involves loved ones. Wrapping things up for this week, we will be traveling to Columbia, Cape Girardeau, and St. Louis tomorrow for more meetings on violent crime and special session. We will be back for a briefing here in the Capitol on Monday. As always, please be safe and smart over the weekend. And remember, we can take steps to protect ourselves from COVID-19. I cannot say this enough. Social distance is a key. Wearing a mask, wash your hands. As long as we continue to do these things, we will continue to recover. Thank you, and God bless. Kelly, Dr. Williams is here also. Backstage.
All right, Director Chin. Sebastian?
Hey, Director, just a quick one. So you mentioned that the grant program is for smaller meat and poultry processors. Can you describe what that is? Is there a number of employees, or what's that designation mean?
Yeah, so anyone under 200 employees will be eligible for it, and that's custom exempt and state and federally inspected facilities.
Brian?
Yeah, Director Chin, thanks for your time. On the follow-up on Sebastian's question about the small meat and poultry plants that are in Missouri, do you have a ballpark number about how many of those plants are in the state? Thanks.
So we have 180 that are federal or state inspected, and we have about 300 that are custom exempt inspected.
All right, thank you, Director Chin. Director Stringer? All right, thank you. Dr. Williams?
Thank you.
Sebastian?
Hey, Dr. Williams.
Hey, Sebastian.
So since the beginning, I think that the state started putting out updates and set up the dashboard. The positivity rate that's been available has been the overall positivity rate. Would a 7-day average positivity rate give a clearer picture of whether more people who are testing positive than the overall? And what's the logic behind only having the overall?
Well, I look at the 7-day every day of my life. It started at 2:30 this morning looking at it. It's about 6.9% today, I think 6.6. So, Sebastian, we put on the website the 5.6, 5.7 you see. But as some of you have pointed out, that what I'm really interested in is the 7-day, what's most recent. And we're going to talk about that a little bit more today, but as you know, that's been running about 3%, 4%, the 7-day. And it is trended up to about 6%. So we watch that very closely with the R0, which you remember again is the infectivity, how many people would be infected, and that's trending up. It's 1.3 now. I think I told you 10 days ago it was 1 for St. Louis, and this morning it was 1.3 for St. Louis and 1.3 for Kansas City. So as the governor said, we're stable, but we're going to talk a little bit more today about we are trending up. And we think, again, that's about 37 to 40% of our new cases are in the 20 to 30 age group. And we put out on social media today a very interesting graphic showing a month ago for a month and a month most recently. and it's just dramatic, the difference in 20-year-olds and 30-year-olds, and that's really driving those numbers you're seeing, the 7-day rolling average, the R0, all those things. Again, following the same similar trends. And I want to be careful here because, I think that sometimes when we talk about 20 and 30 years old, we could, stigmatize them, and my children are that age. And so the message is we care about them greatly. They are not a high-risk group like 80-year-olds. But we don't want them to get COVID-19. And so we're seeing that happening. And so just, as the governor said, forget the numbers. We just care about them. We do not want them to get COVID-19. I spent 30 years practicing obstetrics. We stratify people. Every woman, she's either a low-risk pregnancy or a high-risk pregnancy. But even low-risk pregnancies can have adverse outcomes. So again, today we're going to go with St. Louis, the Redbirds, moving west to east. But if you're a young person, and young people like to congregate, they like to go to pools, they like to go to lakes, they like to go to concerts, they like to go to social events, and we understand that. But if you're going to do that and you just can't social distance, you need to wear a mask. You really do. And so thank you for the question, and we look at that every day.
And just really,
Okay.
Hi, Dr. Williams.
Hey, Phil.
Hospitalization data hasn't been reported on the dashboard since the 15th because of the White House decisions on data reporting. How long do you expect that transition to last? And in the meantime, what does it mean to have limited situational awareness?
Yeah. Philip, great question. I had a meeting this morning, and it's going to be a week. The Missouri Hospital Association is not going to report that out this week because of the issue you bring up of switching over to the tracking system that's at HHS. And so they will put that out next week. Now, your question to me is, how does that affect your modeling, and how does that affect Sebastian's question? And we know that hospitalizations are trending up. We don't have the exact data that we would have had last week or we'll have next week, but we know enough to know that they're trending up.
and so just to follow up, so could you publish the 7-day average, and why wouldn't you do that?
I don't know why we wouldn't. Let me check on that for you. I certainly look at it every day. I know that and have for the last 3 months, so I don't know why we couldn't share that with you. One other thing before you ask, I do want to thank some people today. I just got off a conference call with the CDC and the Feds, Operation Warp Speed. I chair the Preparedness Policy Committee for ASTO, all the state health directors. I'm in charge of emergency preparedness, and just got a briefing from Warp Speed, which is our vaccine. And so we're incredibly appreciative for those Missourians. $1.9 billion given to Pfizer, and got a great report on what they're doing there with their messenger RNA virus. They're highly hopeful that that will be available in January. Don't know that, but things are very promising. I want to thank our colleagues at WashU and St. Louis University that are doing clinical trials right now. Thought leaders in the country doing those clinical trials on those vaccines. And I want to thank those Missourians who will sign up as part of those clinical trials. I was very appreciative this morning. One of the first things I read was a newspaper article that posted the websites where if you wanted to be part of those trials, you could either call SLU or WashU. So to the media, I greatly appreciate you publicizing that, because that is really important that we enroll people. They can be up to 30,000 people. I think these are 3,000. But we need volunteers. People asked me yesterday would I do it, and absolutely I would sign up for that study. So thank you.
I want to clarify real quick. So you know enough to say hospital trends are going up, but you don't have specific numbers, is what you're saying?
I don't have as exact numbers as I had last week.
Thank you.
Dr. Williams, today
Yes.
we saw another record-setting day in Missouri. Is that because of the backlog of tests?
It's partially because of that, but I think that would be misrepresenting it to say that's mostly that. We're trending up. When we look at our R0, our positivity rates, I think that the numbers around 1,000 are reflecting reality. Now, we do have a backlog that we think will be gone by Friday. We're adding people. But I think to say, well, this is just a backlog would not be a true representation. We think this represents community transmission, primarily among 20 and 30-year-olds.
And that just had to do with the number of backlog. Has that 7,000 number gone down? And if it has, what is it at?
I don't remember the number this morning. I've spent a lot of time looking on how to fix it. We're hiring temps, training other people. We actually got down granular today to calculate just how many hours and how many shifts and how many entries you could do in an hour. But I think we'll be caught up by Monday or Tuesday.
Hi, Dr. Williams.
Hey,
I just
Connor.
wanted to follow up on the Pfizer agreement, or
Yeah.
just kind of what's going on with them. What is Missouri's role in that right now in the distribution of this vaccine, the potential?
Yeah, it's a great question, because that's what we were talking about on the conference call. I quit writing at 10 things, the things we will have to do to get that vaccine to people. And it was great because I had my colleagues from the CDC, and we're really building off the H1N1 epidemic. And if you remember that in 2008, 2009, we were giving a flu shot and an H1N1 shot at the same time. And we learned a lot from that. So one of the great things today was I had Jay Butler, who very much was in charge of that, a good friend of mine, went to medical school with him, as a matter of fact, sharing with us his experience as we look at all the things you have to do to get that vaccine out, the distribution, the administration, how we allocate it, who gets it first. One neat thing they told me today, for your edification, is that they're going to manufacture the vaccine in parallel with development, so that they think as soon as it gets approved by the FDA, they'll be able to put out 100 million doses very quickly. They're not going to wait like they normally do. So, okay, now we know. They're doing it in parallel. And they're doing that for more than just Pfizer. They're doing that for at least 2 other companies and 3 more coming on board. And the quote was, we're going to have a lot of horses we can ride on here, so we can get one or more that work.
Yeah, Director Williams,
Right.
good afternoon.
Good afternoon.
DHSS is still listing hospitalizations and has, I know, for the last 6-7 days at 875. Do you know when that will be updated? I understand it has to do with the feds, but do you know on that?
I think it's a week from now. I really do. I think it's going to be next Wednesday when we see that number. But I think it's right at that number to the best of our ability right now, right around 900.
Last question, Jessica.
Hi, Dr.
Hey,
Williams.
Jessica, how are you?
Good, how are you?
Good.
So, we've heard the governor say he doesn't want to implement a statewide mask order. I haven't heard you disagree with that statement.
I don't.
Why? I guess why?
Yeah, because really 2 reasons, and I get asked that constantly, and obviously I brief the governor, so when he says that, he's been briefed by me on that. The first reason is, I was looking at it today, Missouri is such a distinct, diverse state. I think I told you last week, I looked at it today, and we've had 85 counties that have had 1 death or less. Okay, so that's very different than the experience, unfortunately, they've had in St. Louis County, where they've had more than half our deaths. And I think I mentioned to you last week that we have about 50 counties that have had less than 30 cases. So I've been to every county in the state, and I would tell you that if you're within 3 feet of people, wherever you are in Missouri, you need to wear a mask. But to issue a statewide mandate for Worth County or some of these other counties, Hickory County, Holt County, that have had 1 case in 4 months, I think doesn't lend to people following that. And I don't think it's necessary. But if there's 3 feet, they do wear a mask. And the second thing is what we call selective enforcement. So if you issue a mandate, and we see this around the country, and I decide if you're going to mandate, if you think you should do that, then you should have some enforcement. It becomes very difficult to say, okay, we're going to punish you, we're going to do something to you, realizing that there's a huge, vast majority that you're not going to do anything to. And so that's always a great concern of ours, is that if you're going to put something in place that's a mandate, then you need to enforce it, and that can create more problems than it solves. So that's why I briefed the governor that way, and very much appreciate his listening and getting insight. And so thank you for asking the question.
Thank you, Dr. Williams.
Thank
Governor
you.
Parson?
Sorry, Kelly, real quick. I have a question for Director Stringer, if that's okay.
That's too late. We're going to go with Governor Parson. You get Deborah Walker as his communication director. She'll be happy to answer it. All right, Governor Parson. Go ahead.
Thank you. Governor Parson, this is regarding the question on charges being filed against the St. Louis couple that pointed gun towards protesters. Before that, any charges were made, you said you would pardon them if there were charges. Are you still planning on doing that, and how does it look moving forward?
The pardon would be on a sentencing process per the Constitution. They would have to be convicted of a crime and sentenced to stay in prison, and then you could put the pardon in place at that point, before they ever made it there. Yeah, I've been openly, those people don't deserve to go to jail at all. They don't need to deserve to go through the system the way they're being taken through the system. They were law-abiding citizens protecting their property. And for what's happening up there, to me, is just unfortunately, there's a lot of politics being played up there on the local level. But I'll go back to what I said the other night. No matter who it is, no matter where you live, no matter what your political affiliates are, if a mob of people started coming towards your house and your family, all you have to do is ask you a question: what would you do? And if you were scared and didn't know what was going to happen, it's pretty simple. You protect your family, you protect your children, and you do everything possible. And that's exactly what those people did.
So you're encouraging county commissioners and county leaders to spend the CARES Act money that you've distributed. Did you not anticipate the difficulties that they might have in spending that money when you allocated it? And would you do anything differently if more CARES Act funding for local governments comes down the pike?
No, I think it's pretty plain for them. When you look at testing, we know how critical that was. That's been there from day one. When we look at contact tracing, we know that was there. We know if it's COVID related, like getting school supplies in there to start schools, whether it's for the churches, whether it's for the communities. Most of the county commissioners get what those guidelines are. I'm not sure all the reasons why it happened. I haven't talked to them personally, but the big thing is that money's sitting there. We need to be able to utilize it right now. Simply as we up the as we up the test and the positives are start coming back. That's why contact tracing was always a huge portion of this, and we've all known that for months now, including the county commissioners. So that's what we're trying to encourage them, get that money out and get that done. That could be probably that contact tracing right now. I would say is one of the most important things they could utilize that funds on for right now.
Governor Parson, I'm going to go back to schools.
Yep.
Some schools across the state are starting to release what the fall is going to look like, whether it be virtual, maybe it be a hybrid, maybe it be on in the classroom.
Right.
What is your message to those schools that still haven't made a decision because the numbers in the state continue to go up? Those schools are starting to be frustrated. A superintendent reached out to me and said, what time and what is the day that we finally have to decide because numbers keep going up in the state? What is your message to them?
Yeah, I think, again, that question becomes a local issue because all school systems are going to be different. You've got schools right now that are in summer school that are not having no issues at this point. And I think you've got those that's going to continue to open up on time, I would assume. But every school district's different, and that's why I think it's very difficult to make a blanket policy when somebody asks a date. I tell you, a superintendent administrator that I have a great deal of respect for in the Jennings School District, Superintendent McCoy up there. I think he is probably one of the guys, if you want to look at information, if you want to see how he's handling that in probably an area that was more challenging than most, he'd be a great resource to talk to. And, you know, the one thing I will say about Dr. McCoy, it's about the students. It's about the students, making sure they're going in there. So again, schools will have to make that adjustments. I would also say this. These schools have elected officials. They have school board members. You know, that should be part of the decision process. They should have a say in that.
Hi, Governor. Just thinking about the numbers, as we just heard from Dr. Williams, that's kind of from the backlog of tests, but it's also those numbers are just going up. So, right. Does that concern you at all? And what is the state doing now to address this continuous uprising?
Let me answer that, Tom. There's not been a day go by since this all started that I haven't had concerns, and I still have concerns. I think a lot of people, there's still a lot of unknowns out there as we're moving forward trying to address this issue. The hospital numbers, you know, with that many people testing up, is probably going to go up. The question is, how long is the stay? How serious is that hospital stay? Is it an ICU? Is it ventilators? Again, all those things have to take factor in that formula. But yes, I think when the hospital numbers come back, they'll be up. I don't think they're going to grow. Well, I don't know. I'm speculating at this point. But I would say there would be an increase in the hospitalization when we do there. Again, it's all about, can the system handle it? Are we prepared to handle it? And again, what is the level of those people going into the hospital?
Brian.
Yeah, Governor, good afternoon. Our Springfield affiliate reported today that the Springfield City Council had a luncheon meeting and that they are discussing a possible resolution asking you to enact a statewide face mask ordinance. One of the councilmen said he thinks it would benefit the hospitals. Do you have any reaction to that?
You know, they can send me a letter. I'm not sure why they would ask that. I've been pretty open about that. I am not anti-mask, and I'll say that clearly again. I wear a mask from time to time. When I feel that need is there, I am not anti-mask. What I am is anti-mandates. I don't think it's the state's place to mandate for everybody in the state of Missouri to wear a mask.
We'll take 2 more questions. Philip and then Jessica.
Hi, Governor. Have you been offered federal officers by President Trump?
We have federal officers here. There's the 200 that come here. Is that the ones you're referring to?
He's sent other officers to other cities. I didn't know if he'd offer, for example, St. Louis or Kansas City.
We have 200 federal officers that already is here. They come in here a couple of weeks ago to the president and asked the Department of Justice to send people in to help. Look, we have an issue in this state of Missouri on violent crime. There's no way to sugarcoat that. I wish I could. I wish that wasn't what I was talking about, is violent crime in the state of Missouri. But when you talk about these homicide rates going up, I'll take all the help I can get to go after violent criminals, wherever that might be, on the federal, the state, and the local levels. That's what it's going to take to clean up this homicide rate and these violent criminals. So I'm thankful that the federal government sent those officers to Kansas City, if that's what you're referring to, the ones that come there. I assume it is.
All right, final question, Jessica.
Hi, Governor. So I just want to go back to the first question. You described the group at the McCloskey House as a mob, but Kim Gardner had said they were unarmed, peaceful protesters. What are the reasons behind you using the term mob today?
Repeat the last portion of that again.
Yeah, I'm just asking, so Kim Gardner has described them as unarmed, peaceful protesters. You said they were a mob. I'm just wondering why you decided to describe them as a mob. Is there anything we're missing there?
Yeah, I think when you do a forceful entry into the place, I don't think there's any question anybody disputes that you're going into a property that you're not supposed to go into because there's a gate, and you're headed towards somebody's house. I think the unknown, the fear that anybody would have in that situation would be problematic to do that. You know, look, 135 homicides. And let me go back to violent crime in St. Louis under Gardner's watch. 135 this year, 180 last year, 40 cases filed out of 180 in 2019. This year, 130 so far. 30 cases have been filed. And you're telling me that a priority of that prosecutor was to file charges against law-abiding citizens and not take care of the victims, not take care of the violent crime in there? It's pretty obvious it's political motivated.
All right, thank you, Governor.
All right, thanks, everyone.